And for Brandy, I was wondering if you said 15 people had recovered.
Yes, that's correct. As of yesterday afternoon, 15.
15?
Yes, 15.
Okay, and so for our numbers, it's only for people who live in Echd County. Those are the only numbers that are showing up on the website.
Right.
And is that for positive and negative cases as well?
Yes.
Okay, all right. And just to clarify for something you said yesterday, do y'all contact folks who positive COVID patients may have been in contact with, up to 7 days prior before they're showing symptoms?
We do, once we start the tracing, they ask for the symptom onset, and then they go back 3 to 5 days back before that to ask where they were at and who they are around, those type of things. And a lot of the tracing is case by case, depending on the situation and where they've, where they've been and those type of things.
Okay, so but that would be 3 to 5 days then, is that okay? That's all I have.
Brandy, yesterday, did you tell Shane that out of all of the positives that we've had, all of them have just been from work and home and back to work again?
Most, all the tracing that we've done, actually all the tracing that we have done, we have been able to pinpoint where they were or where they were at a given time.
Okay, are you going to release that?
At this time, we don't have any links to public places that we would not be able to know who was there at a certain time. But if that happens, we will work on getting to the public to get that information.
Okay, the same newscast you were in yesterday, we interviewed a young lady who says she tested positive at the ER at MCH on Wednesday. Now, she's not on your list yet, and I'm not sure why. We're trying to figure that part out. But she said she was at the grocery store that morning. So we're having a tough time thinking that all 30 people didn't run into people in the public a day or two before they were sick. I mean, Lubbock, we showed you yesterday, has list after list after list. They were at church, they were at the grocery store, they were here, they were here. I just don't see how we can have 30 people and none of them have been in touch with the public before they got sick.
When we do the trace back, we're going by what they're telling us. And also, if you're talking about the video that you posted yesterday from the individual in the hospital, I would suggest that you check that information because we have reason to believe that that is incorrect.
That she didn't test positive?
There's reason to believe that that may be inaccurate. You may want to check into that.
Okay, we can do that.
Thank you.
But again, how can we have 30 people that didn't touch the public?
Well, if that's not what they're telling us, that they went to the grocery store or they went to a convenience store, then we're going by what we're told and we're going by the context that we get. If they were in a location where we could not get that information, then of course we have to reach out to the public to determine who was at a certain place at a certain time. But at this point, we do not have public places that we are having to get that information from the public.
And you're only doing 3 days?
We do 3 to 5 days before symptom onset.
Okay. What's CDC guidelines for that?
I will check with my epi and make sure that I am correct. And if I am not, then I will correct that.
Okay. I have it in front of me that CDC says incubation is 2 to 14 days.
The incubation period?
Right.
Yes, it is 2 to 14 days.
Okay.
Mm-hmm. Do you, would you like to ask our epi?
I'm sorry?
Would y'all like to speak with our epi?
If you think it's best, sure.
Okay, he can probably clarify your question.
Okay, great.
So for the incubation period that you said between the 2 to 14 days, that's actually true. But the viral load changes over that incubation period. So you're not as infective till the viral load actually builds up. in your body. So even if the incubation period, it's such a wide range because we don't know for sure, right? It's between 2 and 14 because we don't know for sure what the incubation period is. But let's say for sake of argument, it's 14 days. The viral load in the body doesn't build up to a level where you can transmit it as much until a few days, and that few days is still undefined. So each county, each public health department may make a different assessment on how many days to follow somebody prior to the date of symptom onset. And so maybe that's the variation that you're seeing. It might also be a very similar reason I could give for Lubbock County's approach to contact tracing versus another county's approach to contact tracing. Many different counties don't give that level of information that you saw published on Lubbock's public health website as to where each patient was or where each person was in what time period. That's also a very county specific sort of decision. So you have county health authorities at the public health department that are taking in this information, that they know what you see, what the public can see on Lubbock's health website, and they're deciding how many days to trace back. They're deciding, is that useful to release in our county or not, based on their medical expertise and public health expertise.
But don't you think, Dr. Saravanan, it's a good example to follow? I think they're pretty,
I really
they're being
can't
very
make a
transparent.
decision. Oh, I'm sorry, I cut you off. Go ahead, please.
I think they're being very informative and transparent.
Yes, that part I will not deny. It is very informative and transparent, but whether or not it changes the outcome, that's what you have to use to decide whether that's useful or not useful. So I'm not saying transparency is not useful. I'm saying from a public health standpoint, is Lubbock able to control their rise better by releasing that information? Well, that's up to question. So I think that's what public health is trying to weigh. How useful is it to release this information? How much of it is going to incite fear in the public versus help control the disease spread? So that's a very, very specific decision by public health.
Dr. Saravanan, we've got to get past this fear thing. I don't think any information that you put out right now is going to scare anybody. More information is less scary. And I don't know why we're 4 weeks in and we're still thinking that information is going to scare people.
I hear you, Scott, and I think the county health people know that. The health authorities know that. They're hearing that from you, and they still have to make a decision on what's right for our community. Just like our political leaders make these calls every day about which is okay to talk about, what's not okay to talk about. They're making those decisions. I appreciate what you're saying.
And I've got clarification that the reason we go back to 3 to 5 days is because for our region and the resources that we have, just like Dr. Saravanan said, it is recommended for us at this time.
Bye. Randy, who's it recommended by?
We have a health authority, of course, that we meet with every single day, and we also have a region leader with DSHS that we get those recommendations from, and we call anytime we have any questions. So those two individuals is who we get the clarification from on what we need to do with each case and also how we do the tracing.
Are those guidelines in writing, Brandy?
Yes.